Now, welcome back to class. I hope this takes us straight to YouTube. How are you guys? Sorry, I'm having some network issues. I hope this is recording as well. Hey guys, good evening. How are you? It's good to see you back, guys, in class again. I'm sorry, I was having some network issues and I think it's rectified now. Welcome back to class, guys. I don't know what's happening, man of us. Good evening, everybody. I apologize for network issues. It happens. I think it's been long we came to class, that's why. And that's why look what he's misbehaving. Please guys, come to class with this link. How have you guys been? How's been your weakness? Your weekend, sorry. I'm sorry for the network issue. Okay, now we are here. I'll manage my voice. I told you guys I'm not still strong yet. How now weekend? Oh, it's been long, almost 2 weeks now. We'll not be in class. Hope to see you guys better today, strong. Let me talk, man. I'm managing. My voice is not still okay. I'm trying to be fine so that we can go on with classes. I pray the cough don't come up tonight. All right, we did something last time. Let's just take a we just do some revision. For those who are new to class, this is Pattern B Pigeon, and we'll do our classes on Mondays and on Thursdays, just for 1 hour. And for those who are subscribed to special classes, we'll have time for your class as well, which we'll talk about later. Those who are yet to subscribe, do wait to subscribe and have time for classes. Okay? Yama, how are you? Ekato, good evening. Jenny, good evening. Now we'll do a recap of what we did last time before we went on a short break. Messi is the manager. I'm just managing. I'm just managing. This was where we stopped last time. Guida in relazione alla qualità e condizioni fisiche, alcol, droga, farmaci e primo soccorso. You're driving according to the quality of your psychological condition, your physical condition, according to the alcohol and the drug you take, and then your pharmacy. That is the things you take that will disrupt or that will prevent that will reduce your ability to drive. You can be driving well because of these things you take into your system. It will reduce you from driving it. It will reduce your alertness, your flexibility to drive. We talked about these things last week. That's when you drive and you feel you're tired, make you park your car somewhere and relax. It's not against the crime. And then there are some drugs you use, it will affect you. Like all these drugs, like antidepressive, anti the, dispre- the depressive drinks, drink medicine. You are depressed, you take some drugs, it will make you sleep and dizzy. You can't drink and drive, and you can't take some kind of hard drugs like drugger to drive. This we've done already. And then when you eat some food. You need to relax, make your food digest before you enter with the drink. Before you enter with the drive, it's like you can't just take pizza, take some more, and begin drive. You have to relax when the food dies because as the food they break down during digestion, it makes you dizzy. This we've done already, and then remember primo soccorso in case somebody you they involved in accidents or you dare for happen, you have the moral right to help. You're obliged to give assistance. Even if now you hit somebody, you can't hit and run. And that giving assistance will not reduce the crime where you commit. You still pay for it, but you have to stop and give assistance. And that then they make it do according to your own capacity, not do pass yourself. You not be doctor. Just to the aim of first aid is to keep the patient alive while doctor comes. That's it. That's the aim of it. So it's not you begin to do so you be doctor. You have to keep the patients alive while doctor come later. We continue. We talk about when somebody they bleed, how to keep the person wait for doctor. All these things we've done. You check my video, we see these things already. So let's go to where let's continue for where we stop because we already past and it's almost 9 o'clock and it's already late already. So let's go to class today. If you have any questions, please. Miss Jare, I just tired for this cough. I'm tired. I have a little influenza. It went worse and then sore throat and then cough. So I'm still in the process of healing. But I can't just wait for most to get well. I need you guys to need this class. So I have to come back to class today. So where are we today? Sorry, when is your exam? This is about when is your exam? Sorry, when do your exam? Now talking about state of inconscience. When somebody they unconscious, that means state of inconscience. For those who are joining us, this is chapter 22, meaning we almost finished this Guida. We almost finished this section. We just need two more topics to end this section. So join us. We'll begin again. You'll be part of us. So just that you know so you already get this two for hand and then join us from the beginning again. It sounds strange. It sounds boring because yes, we've gone a long we've been doing class for almost 3 months now, 2 months now. We've gone a long way. So just stay, don't leave. Okay? I'm talking about unconscious state. If somebody get accident, they come there unconscious, what would you do? Se un ferito della strada è in stato di incoscienza, what do you do? How do you know say they inconscient? Is they unconscious? Because that's a faint. Because one, non reagisce a stimoli semplice. The person only reacts to simple stimulus like you call the guy name, you put hand like this, make the guy move eyes, no they move. Some signs is not it just did there. Or non in grado di eseguire i movimenti, not if even follow some movement, some signs. Or non è un grado di rispondere a una domanda. Because sometimes when they come help you or when this first aid book come, they go ask you your name, what's today's date, where are you from, where are you. If not you answer those things, meaning you are just there, you are just unconscious. They do all these things to know if you're unconscious. And when it happens, what do you do? The person there, non essendo capaci di provvedere a se stesso, bisogna vigilare sulle sue condizioni e prendersene cura fino all'arrivo di personale medico. The person can't take care of himself. So he's just there like that. What do? You as a person, you have to like be there with the person, just be there with the person. That is vegliare, stay awake with the person and see his conditions. Wait for doctors to come. That's what it means. So the person cannot take of himself. It's just there. He can't be himself at all. What you need to do is you, as a person, we could just take care of the person, leave the person there and take care of the person. Wait for the doctors to come. That's what it means. Any question? I'm sorry. I'm trying to share this link to somebody. I beg one of us. And then we continue. Morvelo solo se scete di non abbia trauma alla colonna vertebrale. The person lie down like that is unconscious. Move the person only when you sure say person not get trauma for his spinal cord. Colonna vertebrale, not his spinal cord. You not get pain, not get injury. That's it. To move the person like that. Aye, Jerry, aye, George, I'll do that. Bisogna verificare se respira ancora ponendo le mani sulle parte bassa laterale di torace o sull'addome. Make you verify see the person still breathes. Make you put your hand on the basal side of his abdomen. Touch him if he's still breathing. Se respira a fatica, liberare naso e bocca da eventuale ostruzione. The person they breathe so is they breathe slowly. They breathe they very slow. Make you check if something close in nose, maybe blood enter in nose or vomit enter in throat. Remove these things, they can breathe well. Se respira spontaneamente, porle in posizione laterale di sicurezza. The person they breathe. This we've done before. I think we did this thing last time. That's what we did in my last video. The person they breathe fastly. Maybe put on for side safety position, which we've done before. In our last class, I showed you pictures. Make you bend the person. Let's see this positioning. I did it before. Is even my last video. I think it's time you go watch the last video. You see, I think I did this last topic before the end of last class, and I explained it very well. So do not waste time again. Maybe put the person for a side position. You put the person for ground, put her for one side, bend one leg up, that's bend one of the legs, put her for one side, then put the hand for the head like that. Go to my video, you see the last video before this one, you see there to allow blood flow back to the brain. So now we go to the fresh topic of today. Thank God I've seen that we've done that before. Gary, I look good. Hmm. Maris, I'm not looking good, I beg. Personally, look good like this. I'm struggling, Jerry. Trauma alla gabbia toracica. Trauma alla gabbia toracica. What's gabbia toracica? You hit your ribs, your rib cage. Maybe you get accident, the car whole break or something hit the car. You can't hit your side for chair or for somewhere, and you get pains. You get trauma for your rib cage. What do you do? Trauma thoracica. That's you get trauma, use your hit your heart or your chest, they hit somewhere and you feel pains in it. What do you do? Puoi comportare frattura delle costole o dell'esterno aggravate da possibile lesione a polmone. If you fracture inside your body, your chest, your rib cage because of pain, maybe you hit them from somewhere. L'infortunato respira con molta difficoltà, patendo occure. The person hit your chest for chair or for something around the car. You breathe. The person they breathes with great difficulty. What do you do? Cercare di facilitare la respirazione mettendolo semiseduto. The person they breathe with great difficulty. That you should try to easy the breathing by putting him on what? Semi-seduto. Put him make it sit down half, we'll see the pictures later. Semi-seduto. Mettendolo semi-seduto. Proibire di bere o mangiare ed assisterlo fino ad arrivarsi il soccorso medico. Don't let the person drink water or even eat anything at all. Wait until doctor arrive. Probably they get internal injury. or the rib cage don't break. And if you drink water, if you affect or eat, so don't make them drink water or even eat until doctor comes. Se vi la presenza di ferita visibile e profonda, bisogna comprimere subito con un panno pulito senza provvedere a pulire, disinfettare o medicare le lesioni. The person hit the chest for something and you see the pain, you see the injury very deep inside the chest or the side, the rib cage, that you need to cover it with something clean. That's all you need to do. And don't clean it, don't disinfect it, not put medication. That's what you do. Just wait till doctor come. Very easy like that. We'll see pictures of this later. A Bridgetti, come on, I'm not closing short. I'll close my camera now. Fractura ai atti. Fractura ai atti. You get fractures for maybe your hand or part of your body. What do? You fracture part of your body, maybe hand. How you do? We'll see pictures on this later. Just to explain now. Later I'll show you pictures. La frattura è la rottura di un osso. Fracture is the breaking of a bone. Se esso fiorisce la pelle, la frattura è data esposta. You break your hand, the bone can't come out. They call it exposed fractura. It's exposed. You break your hand or leg, the bone can't come out. It's called exposed fractura. I segni principali di una frattura sono il dolore, volatissimo, anche a minimo movimento di atto. One of the principal pains of fracture, one of the principal signs of fracture, and pains, great pain when it will cause on your body. You get this pain, the pain is much on you. Na show that person don't break it bone. Il gonfiore o la deformazione della parte lesa. The place go dey swell or go dey deformed. The bone bend, go dey deformed. Si deve immobilizzare la frattura dell'espressione in cui si trova per evitare lesione dei nervi o vessi o mutazione involanti dolore. Is what you do that you have to move the person in a way that you not cause more pain to avoid more injury to the nerves and minimize the pains where the person they get. Che possono portare allo stato di shock because that pain will lead to a state of shock. Because if you get this pain, I'm going to shock, and which is bad. Subito dopo è necessario attuare le normali misure anti-shock. If possible, give them anti-shock to reduce the shock. If possible, give them anti-shock. Attuare le normali misure anti-shock. In caso di frattura esposta, cioè dove l'orsa fiorisce della pelle, in case the person get this fracture, the person rupture, break his hand and he come exposed, come out from the flesh, what do you do? Non si deve spingere le ossa nel tentativo di farlo rientrare mai. Not begin to twist the hand, make the bone enter back. You know, normally like us now, person just break hand, first of all, rush, put the hand back. Yeah, you don't do it. Non si deve spingere le ossa. You don't have to push the bone back to its position. Ma prima di immobilizzare il lato, occorre coprire le ferite e le ossa con materiale sterile. You have to just cover it with something clean, a clean cloth. Don't push it, don't touch it, just leave it. Or con un pane pulito per evitare infezione, with something clean to avoid infection. Occorre sempre attendere il soccorso. You have to always wait for the right doctors to come. Non go do past yourself. Non go do past yourself. Non è vero che è necessario chiedere alla vittima di muovere gli atti o farlo camminare per ridurre il dolore. So it's not true. It's not necessary. It's not true that it's necessary to ask the person, may move. Say, try move your hand or leg or try waka. It will reduce the pain. No, it's not true that you must necessarily ask the person to move any of the parts we don't break or to waka to see the pain go reduce. Any questions? With the cough now, I can't even talk fast. I think I'm small. Hmm? My fault. Now, we're talking about, no worry, I'll show pictures later, okay? Just calm down. Talk about unstione, ustione. What do you mean? Maybe during accidents, the car can burst into flame or it can catch fire. And then people they inside the burn, you basically come out with burnt body. You did it, what you go do. Okay? What you go do. Se un ferito presenta unstione, burning for body, se ancora presente fiamme, bisogna spegnerle, soffocandole, ad esempio con una corpetta. You see, if car get accidents and people come out with burn their body, the fire still in their body, the flame in their clothes, what you do, make you off the flame. How you do? Suffocate the flame, cover the person with another cloth, make it off the flame. Evitare di togliere gli indumenti rimasti attaccati alla pelle bruciata. Avoid to remove the cloth we burn. Maybe fire burn, you can't off the fire, but the cloth burn and they can't attach to his skin. Don't put the cloth, leave on like that. Raffreddare la porzione di pelle ostinata con acqua fredda. Put water for that part we burn with, put water, cold water, make the tinte, that is stop the heat. Raffreddare, make reduce the heat of the burnt body. Put cold water for that part. Conviene coprire con materiale pulito, possibilmente sterile. It's convenient to cover that part with clean cloth, clean materials, or if possible, material sterilized. Non disinfettare né applicare pomate o alcol sulle parti ostinate. Not disinfect that part, or even apply pomade, cream, or even alcohol for that part. Will not be alcohol they drink with this alcohol with a clean wood. Don't apply it for person we get we cloth burn joining body during accident. Just leave very simple things you could do. Not do more than these things. There are simple things you need to do. These are simple things that they call first aid. Why you wait for doctor, you do these things to keep the person alive. What it means. Then occhiali da vista or lenti a contatto. You go as you begin driving school now. They actually you see they use glasses. They can't say they can't see your glasses. They correct onto your license say this guy they use glasses they drive. What do you do if you they use glasses they drive because it your driver license? Like some people they use glasses like me. My glasses is to read, not to drive, so I will not put it to my driver license. But if you can't do without glasses, you can't drive without glasses, you can't see without glasses, you must add it to your driver license. And what happens if you have to drive with it or without it? Durante la guida si devono usare gli occhiali da vista o le lenti a contatto se nella patente presente per estesso o sotto forma di codice ammonizzato 101, tale obbligo. If you dey drive and you know say for your license or when you go driving school, you talk say you dey use glass to drive, meaning you must always put on your glasses to drive. It's a must. You're obliged to wear your glasses 24 hours as far you are driving. Meaning, if you use glass, say you did say use glass to drive, the right for your license, you have to build your glass 24 hours. When you can't do without it, is it important more than like, you can forget license, but don't forget your glasses because when police see you, I think you reduce your point for you may get muta. They will see that they will move the muta for you. They'll give you muta and move a point from the driver license. It's important that you use these glasses to drive because if it happens tomorrow, as it happens, the fair asks you, The self for this, you know, do your glasses, meaning now you be the fault because you not see well. So when you go do driver license, you use glasses. Know that it's for reading. Don't go say I wear glasses to read, but I can't drive. No, don't make that mistake because you have to put on glasses 24 hours of the day when driving your car. Any questions so far? Any questions so far? Any questions? So just a recap of what we've done today. So we've done before. Okay, about say if somebody present pain for the rib cage, alla gabia thoracica, which is the rib, you hit your ribs, you drive, you hit your chest for something because they feel pain. This is how. What do you do? Remember I told you before that you should do what? Wait, make doctor come, but before then, check to allow the free breathing of this person. Put him sit down, bend himself, half sit down like this, relax your back, sit down, not sit down fully, but half sit down. And then if there is a wound on the chest, what do you do? Cover it. Don't clean it. Just leave it. Just cover it with clean cloth. And make the person not drink water or eat food. Then so now when you talk about ustione, when the born person they inside fire, the person come out from inside fire and it's close to the bone, the car burst into flames and it's close to the bone. What do you do? They say what we'll do. Make we try to off the fire, suffocate the fire by covering the person with under cloth. And then he said you are not advised to pull that cloth. If the cloth will burn remain for the guy's skin, don't pull it. And then to reduce the pain, make you put cold water to where the body is burnt. Use cold water on the person where the body is burnt. Then, if there's injury on the part of the body where the person is burnt, cover it with cloth, clean materials, and wait for doctor. We talked last time, say, if person something enter person eyes, we talked last time. Trattamento di un ferito comprende un corpo estraneo in un occhio. Corpo estraneo is external bodies. Oh, sorry. External bodies in the eyes. Somebody the make accident, glass break, enter the guy eyes, wood, iron, enter the guy eyes. What do? You just bandage the eyes like this. Bandage the eyes. Don't massage the eyes. Not force the person make you put eyes down the wait for doctor. Just bandage the eyes and wait for doctor. That's what they tell you. If not clot you see, they can't bandage the eye, make person close, make the eyes they close like that. Don't touch the eye, begin to massage the eye, the pressure. No, to avoid much damage. That's what to do. Okay, so this is what we've done today. Any questions so far? Any questions so far? When somebody break hand, infortunato che ha portato fratture di agli atti, the person break any of the bone, you fracture the bone, what do? This is what you do. You don't need to move the hands. You don't need to put back the hand. Say the hand, okay, you know, you did do one for before you do one for village, and they repair bones. No, as far you're not a doctor here, you can't do those things here. Though you may be doing it in the right way, but here you have to be authorized to anything you do here must be a professor to do those things. And if the bone break can't come out, don't push it back. Just do normal things to the first aid and wait for doctor. That I told you. Any questions? We've done all these ones last week. Any questions so far? Any questions? So our new students will come to class. We've gone, I told you, we don't go a long way. This is just chapter 22 already. We need 2 chapters to finish this section. So if you join us now, don't like give up, say because you're joining us now. No, continue with us, okay? Continue with us. You'll get it better right one day. So just go on with us. And then we'll come back again and then we are through already. Any questions? Any questions so far? Any questions? We'll try to quiz. Okay. I know we've done these things before. We'll just try to do one quiz for this topic before we go tonight. I know it'll be 2 weeks, so we might have forgotten one or two things, but let's see if we can get them back. Remember, when you do quiz, don't wait on me because myself, I'm a fairly quiz. I know they teach for driving to do driving exam. I'm just teaching to help you guys. So I'm a fairly quiz myself. I never know it, but let's try and see. Okay. I told you those who are new, don't rush and start doing quiz. Take it one by one. Go and start from the very beginning. I beg you. Not begin a rush to do quiz. Say you want meet up. There's no it's not a competition that you must do it. Take it slow and steady, one chapter at a time. Like we do now, we do one chapter, we'll do quiz. That's how we'll do it. Then do quiz on that chapter until you don't know the quiz before you move to the next chapter. Don't rush it. Take your time. Give yourself like 2-3 months to study, and then you're good to go because of your activities, your work, family chores, and everything. Don't rush it. Take it the way. It's not your language. Nobody will give you license. Nobody will give you money for doing this thing. So let's go. Let's go now. 22. Let's go. So see if you can also get the quiz as well. Let's go. Lo stato di shock può essere causata da un forte trauma. Se if you go into shock from strong pain, strong trauma, if you just go into shock because person is shock from pain, go into shock, which is true. So we did last week. So don't forget it. We did last week. Per diminuire il dolore delle ostine si deve, se possibile, farlo uso di acqua fredda. To reduce the pain from burnt, we use as now ostizione. To remove the pain, they reduce the pain from person with burn body. You must, if possible, use cold water. Remember, we said these things to reduce the pain, to reduce raffreddorare, so at least cool the body, the person, if possible. Se un infortunato della strada è un ferito sanguinante, là si deve coprire con materiale sterile o quanto più possibile pulito per bloccare il sanguinamento. You see, if somebody will get injury for road accident, they bleed, what do? Like if possible, may cover the place with clean material, possible material, so that at least to block the flow of blood for the meantime. Cover around with clean materials. You see, you see this question long now. You have to be able to read to some extent and understand to some extent. So it's not just that you can't read. You need the language to some extent to understand what you're doing. So imagine all these things now. You know what I mean? So see, you have to use clean materials to at least put them to block the blood a little bit. You know all these things now. Se un ferito della strada è in stato di incoscienza e fa fatica a respirare, bisogna liberare subito il naso e la bocca da eventuali ostruzioni. Person with wound for road, they unconscious and you know they breathe, that is fatica, they breathe so lazily, they breathe well. Make it quickly remove, that is free the nose, maybe blood day, vomit day, or the mouth from any obstruction, which is true. This I've explained before. Se ad un infortunato della strada è entrato un corpo estraneo di un occhio, bisogna cercare sempre e comunque di toglierlo. If person will get accident, un infortunato for road, then external bodies enter the guy eyes, maybe glass bottle, something enter the wood, and you enter the guy, that you should always look for a way to remove the thing. Bisogna cercare sempre e comunque di toglierlo. Remove it, which is fast. You can't just remove it. Don't try it. It's falso. Se un ferito della strada è in stato di incoscienza, bisogna facciali la testa. They say if somebody dey instead of shock, sorry, yeah, unconscious, make you what do you know facciali la testa. That's what facciali mean. Let's see what facciali mean. You have to wrap. It means wrap the person head. Wrap the head. You see how this thing now is look for before. Don't just jump into quiz. If you meet any difficult thing, no, look for the meaning. It's not a language. Okay, for the meaning. The person going into shock. What you do make you wrap the person head. Wrap that what it means. Yeah, wrap the person head. I don't know. Your computer may have this thing too. Make you wrap him up. Wrap the person head, which is not true. You see all these small things. Now, if you know this thing, you yourself for exam again, you go exam all over again. So you know everything you ask, you can do these things yourself. You have all these things online to check all these meanings fast. So if there's a word you don't know, don't just guess. Look for that word. Be patient. L'adozione di acqua rende più sicura la guida perché annulla la stanchezza. You take in you take in alcohol. You consumed. You assume. You take alcohol. You see, it render you pure sure to drive. Render physical guida because it cancels. It removes your tiredness. You drink alcohol to remove tiredness, which is not true. Alcohol make you even tired more. Sorry, I'm slow. I'm taking it slow. We might not even beat time, but I'm taking it very slow so that you understand how these quiz are done. Those who are new, this is how you do quiz. Don't rush into quiz. Take it small. Number 8. Un ferito di stato di sciocco va messo in terra, se possibile, con le gambe sollevate. We done this in the past 2 weeks. So I mean, you must forget now. Person dey into shock. Make you put down for, make you lie on down if possible. Make you raise one of it, sollevare, raise the person gamba, raise the leg, con le gamba sollevate. Try raise the person leg so that make blood flow back into the brain. This is what we've done before. Remember. Soccorrere subito un ferito della strada, poi evitare che subisca ulteriori danni fisici. You soccorrere, like you help somebody, give somebody first aid, subito, for road. It can avoid that the person go sustain more injury. Yes, could prevent more injury from the person if you help him out immediately. You give him first aid. Se un infortunato della strada hai riportato fattore ai atti, bisogna bloccarli e subito dopo necessario attuale normale misura anti-shock. If person dislocates in hands, it happen. May you block am, put wood, something to hold the hand, POP like that. If possible, give an anti-shock. Yes, it's true. Subito dopo è necessario anti-shock. We have 12 minutes, let's go. Se fortunato la strada ha riportato fattori altri, bisogna bloccarli senza procedere ad altre manovre. The person enjoy hand, the break hand, block the hand, and don't make any movement. Yeah, without proceeding to make not any movement. Let's say, yeah, turn hand, go left or right. Try raise the hand up. No, just block the hand with something. Leave it like that. Se un fortunato la strada, un fortunato na unfortunate person will get accident for road, infortunato. Ha un ferite sanguinate, se devi versarvi sopra acqua calda per fermare il sanguinamento. Se person will get accident, when they bleed, make you put hot water to block the bleeding. That one is false, so don't go try am. Say the question long. Say it long. Don't worry. Liberty, don't worry. We'll sit down later. Don't worry. Durante un intervento di primo soccorso, se infortunato a un ferito sanguinante, si devono togliere subito gli eventuali corpo estraneo in essa presenta, se si ricopre la ferita. Se if person during they do give person first aid, the person gets injury and they bring out blood. Make you remove the place, that's remove the skin or remove the external bodies within inside the person body and then cover the wound. No. If anything enter the body, don't remove it. Cover the body with cloth way clean, but don't remove the wound or the nail or the ass we injure the person. Don't remove it. Wait, doctors come. Se devono togliere subito gli eventuali corpo estraneo, corpi estranei na external body enter the person blood. Don't remove it. The body, don't remove it. Wait, doctor comes. È consigliabile guidare quando si ha un stato emotivo alterata. È consigliabile. Don't rush. Look for this word. È consigliabile. This one will confuse you. When there's X in the front, it means not. When X stay the front, it means it's not advisable. If there's no S, it means it is advisable. So be careful. When you say anything that's conciliable, meaning this is it is not advisable to drive when your emotions are not normal. Your emotion is altered, which is true. Remember, if there's no S here, it is false. But since there's X, it means it negates the other one. It is not advised to drive when your emotions are high. But if there is no S, it means it is advised to drive. So now it is a conciliabile, meaning it is false. This means it is true. It is not advised. This X means not. Okay. Don't forget this thing. It can deceive you many times. L'ausilio di alcol può far diminuire il livello di attenzione. The consumption of alcohol can reduce the level of attention. All this means, which is true. Chi guida un veicolo senza motore con una concentrazione di alcol nel sangue superiore dei limiti subiti non è soggetto ad alcuna situazione. So you drive car without an engine, like bicycle, senza motore, and you take high alcohol for your blood past the limit, that nothing will happen to you. No, you are still wrong. È falso. Something will happen to you. They'll give you sanzione, they'll give you multa. L'idoneità alla guida può essere compromossa se si fa uso di bevanda alcolica. Your ability to drive can be compromised if you use alcoholic drink while driving. It is true. Durante la guida si devono usare gli occhiali di vista o le lenti a contatto se nella potente figura può per estesso o sotto forma di codice tale obbligo. You drive, you use glass to drive normally. Whatever glass you're using, you are obliged to use the glass while driving. Yes, it is true. Dopo un incidente stradale, il soccorritore che interviene deve valutare bene la situazione per proteggere gli infortunati da altri pericoli. The accident happened, you can't save person. You have to evaluate first the situation so that you prevent other injury on the person. It is true. Not just rush, because in Nigeria you'll be midwife. È necessario che trascorrano alcune ore affinché un conducente che abbia assunto una quantità eccessiva di bevande alcoliche ricopri l'idoneità alla guida. It's necessary for you to take some hours as a driver after you don't take in enough quality of alcohol so that you go get back your ability to drive. It is true. When you don't drink more than your blood, relax meeting that before you begin drive. It is true. So necessary for you to pass some hours as you're a driver so that you go allow your alcohol to settle down and digest before you begin drive. It is true. We have just 6 minutes. We can make it. Let's try. Sorry, I'm trying to explain everything because of the last class. We've done this thing. We gave some time, so I'm trying to explain so that you get it back again. Soccorrere un ferito della strada non è un obbligo imposto dalla legge, ma solo un dovere morale. That giving first aid to a wounded person on the road is not, you're not obliged, it's not something that's obliged by the law, but just your moral conscience. No, it is obliged by the law and then moral conscience. So it is two ways, not just one. The law obliges you, and then your moral conscience also obliges you. So it is falso. Lo stato di shock può manifestarsi con improvvisa pronuncia di frasi e parole senza senso. About talk of when person go into shock, what you go feel. You feel the forehead go dey cold. You feel say they talk any, if you talk well. You see the body they that is you get some pills on pale body they pale kind of, and then they pronounce some words anyhow. Improvisa pronuncia di frase. Talk some will not make sense. They go into shock. Talk some words not make sense. With this one in last class. Check my last video. It's true. In presenza di un ferito in stato di shock, occorre farlo camminare per riattivare la circolazione di sangue. If person dey into shock for road accident, that make person waka to allow blood flow for him body. No, you should not make am waka. Put am like that somehow. Relax, make blood flow into your head. Not make am waka. It's falso. It seems true, but it's not falso. L'azione di alcol renda meno sicuro la guida perché può provocare estrazione e imprudenza. You assume the assumption of alcohol renda meno. This is what you look for. Renda meno. Reduce. Oh, sorry. Opposite ava press poi. Your consumption of alcohol reduce, render meno, makes render low, render meno. This meno is minus. It makes you less secure while driving because it provoke excitement and imprudence. You drink, you can't be high, you have alcohol, can't be prudent. It is true. So it's render. You're what you're looking for. It is rende meno sicura, reduce your sureness of driving, and then because it will provoke, it will make you day excited and then they prudent by driving. This true. We have a minute. We have 3 minutes. We can do it. Se un fortunato la strada ha un ferita sanguinante, non bisogna coprirla per facilitare l'arresto esponendo sangue. You see, if person they bleed, sanguinamento for blood, if they bleed, they need to cover the person to allow blood to stop on its own. No, cover the person with cloth. If they bleed, cover the blood. It's faster. 26. Un adolescente che ha assunto una quantità eccessiva di bevanda alcolica non può ricoprire ufficialmente l'idoneità della guida, specie se ha assunto anche dei farmaci. If person dey drive, take enough quality of drink. The person will quick get himself back. Mostly if he can't even take up on top of, I can't take some drugs on top. It is true. So you are driving, you take enough bevanda, you drink enough alcohol, you not easily get back your guida. Even if you drink a drug safe, no. You have to relax, it takes some hours to pass first. È vero. Dopo un incidente stradale, il soccorso che interviene deve assistere gli infortunati a migliore della sua possibilità senza però prendere estive speciali competenze mediche. Fast, like just 2 minutes. You say you will go save person for accident. Make you not do pass yourself. Assist the person as you can, your possibility, without taking any other, not going to do more than, say, for in Nigeria, you were a midwife, you should do more. No, don't do more than yourself. Do the one you should do as first aid, the doctor. 28. Durante la guida si devono usare gli occhiali di vista o lenti o contatti quando indicato sulla batteria. If you're driving, You have to use your eyeglasses or your lenses. If you know, say, you indicator for patenting, yes, you must use it. 29. Se fortunato la strada ha un'abbondante emergia esterna, non si può assolutamente dare da bere l'acqua. See, if person we get abundant bleeding, it's not bleeding, they bleed, that you must not give him water to drink. You must not give him water. You must not, in any case, give him water to drink. I think water to drink not only when you get injury for inside external injury. This one is internal. This external injury gets external injury, external bleeding, external, not interior. You should not give water to drink. You can give. This one is true. Abby, are you sure? Let's check. You can give him water to drink. If he is not that, you should not give water. You must not. So I say you must not. Hemorrhagia externa, not interna. Bleeding. We'll put first there. È stata ha riportato frattura di atti, bisogna coprire le eventuali ferite, combattere la polizia. The person gets rupture, broke, he fractured his hand to cover the person if there's injury with clean this thing, which is true. Now, guys, we might fail 1 or 2 or 3. Remember, might not be correct. I might just be explaining and make mistake too. So let's see where we fail it. Let's see how we did today. We failed just 1. Let's see one we failed. And we'll try. Let's see one we failed. Could be toward the last one. That water on. Maybe that will fail. Let's see. No, fail number 7. Yeah. Somebody said we should check number 7. Okay, that's true. Instead of putting true, I put false. That's true. Thank you. I didn't see the one. Somebody asked me to check number 7 because, yeah, I think I made a mistake. It was me. I interchanged the scores instead of putting for, I put zero. L'azione di accorrenda più sicura la guida, which is fast. So I want to put true. The assumption of a call makes you render. It makes you sure of your driving because it removes weakness, which it was fast. So I put true. Somebody told me number 7. Yeah, pretty. I remember. Yeah, Liberty, you said it. Yeah, that's true. I didn't check it. I made a mistake. So you see now, say everything we don't teach on this topic came out. So what you do now, go back again, do quiz on this topic again, until you get 30. Then move to the next topic. That will do it. So don't just rush. It's easy like that because you're in my class. If you come class, we'll do quiz. You get everything because I go teach you. The way I go explain that to you, break them down to you to understand. That's why this class is like this. It's pitching English class. We explain everything the way it is, word for word, without stopping. So this I will do it. So those who are new to class, you enjoy the class. Don't miss class because my class. If you can attend my class from the first day to the end of the day, from that 2 months or 3 months, you can do it. Even before we finish the class, you can go and do your exam because you understand better what you'll be doing. So this is how I teach, and this is how it should be for those who are new. Welcome on board, and let's continue. Guys, any questions? Any questions so far, guys? Any questions? If you have any questions, I'm done with class for today. So if you have any questions, you can come and ask questions. The link I'll drop here. Just for the next 5 minutes. If anyone asks questions, you can come up. If not, we call it a night. Franklin, God bless you too. Remember to subscribe. I told you some videos are not free. Only few videos are free. It happened because of the abuse. So I have to make you guys subscribe. So remember, check the subscription. When you use advanced or students will give you almost all the videos, but not all. The last 4 you won't see it. Because this one now, you may not see it as a student because I'll block it later. And then advanced will give you all the videos and 30 minutes personal class. Why super will give you all the videos and then 2 hours personal classes. Like today, I did some class with somebody today, 2 persons. We have some classes today for those who are in advanced and super class. So you could just ask a question. You call me, we'll talk about it because you have the privilege of doing that because of your level. George, you can use the link and come up and ask me a question if you want to. Download the link, they take it to you, the app. Download the app on your phone and then you get the link and then you come straight and ask me a question. Or you can write it there if you have if you can do it very well. So any questions? Wait for George to ask his questions and then if not, we call it a night. George, if not, we're waiting for you for the next 2 minutes. If not, we call it a night. For those who want to join our class, you're free. I send a link here. George, your question, George. Is a link to the class. The link to the WhatsApp group class. If you want to join, use that link and I'll accept you on the WhatsApp group. George, I think we have to go. I can't wait again for your questions. It's almost 56 minutes. Good night, everybody. May Lord bless and keep you and give you good night rest. Bless your labor and bless your increase. Bless your family, home and abroad, and make you prosperous in whatever you do. Give you good health of mind and body. Father, Son, and Holy Spirit. So in class on Thursday. Those who are in advanced and other classes will see before then. We'll talk and see how to do our classes. Thank you. It's me signing out from today's class.